Good day everyone, especially to our instructors. So for today, I'm going to discuss to you the emotional and behavioral disorder. Students with emotional and behavioral disorder or EBD often engage in the behaviors that are considered abnormal compared of their same age peers. These behaviors can include verbal outbursts, physical aggressions, poor social skills, and academic delays, which is inhibit the student ability to maintain relationship with their peers and interfere with their ability to succeed academically. According to the Individual with Disabilities Act, the term emotional and behavioral disorder is an umbrella term which includes several distinct diagnoses such as anxiety disorder, manic depressive disorder, oppositional defiant disorder, and more. On the other hand, emotional and behavioral disorder are so disruptive that parents and others frequently want to know what causes of them. So when a child or adolescent consistently has intense emotional or physical outbursts, their relationship and learning must be suffer. Adults and other children and teens are also negatively affected by the eruptions of feelings and problem behaviors. So all of those disorders are often referred to under many levels: emotional disturbance, emotionally challenged, or behavior disorder. Accordingly, the children with emotional and behavioral disabilities have 5 characteristics. So number 1, an inability to learn that cannot be explained by intellectual, sensor, or health factors. Number 2, an ability to build or maintain satisfactory interpersonal relationship with peers and teachers. Number 3, inappropriate types of behavior or feelings under normal circumstances. Number 4, a general pervasive mood of unhappiness or depression. Number 5, a tendency to develop physical symptoms or fears associated with personal or school problems. So now let's proceed on 2 major categories of emotional and behavioral disorders. So we have psychiatric disorder and behavioral disabilities. And psychiatric disorder, a mental, behavioral, or perceptual pattern or anomalies which impair daily functioning and cause distress. So, some of the most common examples of this diagnosis include anxiety disorder, bipolar disorder, also known as manic depressive disorder, eating disorder such as apraxia. So, a child with that disorder are need to receive special education, invention of them of some sort, and may need to be more into special education classroom or separate school program. So now let's move on to the behavioral disabilities. Behavioral disorder involve a pattern of disruptive behaviors in children that last for at least 6 months and cause problems in schools, at home, and in social situations. So, children with behavioral disabilities engage in conduct which is disruptive to classroom functioning and harmful to themselves and others. So, to be diagnosed as behavioral disability, the behavior must not be attributable to one of the aforementioned psychiatric disorder. So, I have here 5 strategies for guiding and supporting growth toward more positive adaptive behavior. So these are time-tested strategies for guiding and supporting growth toward more positive adaptive behaviors. So let's start on token economy. Token economy, a reward system, is standard when addressing the behavior or special needs of children. With points or tokens, students are given constant reinforcement for correct behavior and following the rules. Students earn points or tokens for instances of positive behavior on a set schedule. These tokens can be used to purchase rewards at the token store or prize box. In order for a token economy to be effective and must be rewarded for children to be motivated as well. So number 2 is the classroom behavior chart. This may appeal to any competitive nature in the student. Students who are behaving progressively will see themselves rising up the charts and surpassing others. Number 3, lottery system. This one is simple. Students who show positive behavior place a ticket, name on it in a jar. Once or twice a week, the teacher will draw out winner and award prize. And the last is the positive peer review. It has anyone even thought of reversing tattletailing? This builds teamwork and social support in the classroom. It encourages students to watch their peers and identify positive behavior, and they must win a reward which is both the reporters and their peers. So as a future educator, we need to encourage our students to do a socialization, to play child's emotional adjustment, and we need to provide distraction for their problem, which is to enhance their self-esteem and make sure that we know the issues behind them as well. So that's all for today. Thank you for your listening, and God bless us all.